So greetings also on our behalf. Today with our team, we'll introduce you to the topic of reducing COVID-19 disease at work. So as I said, our team consists of me. My name is Alen, Valentina, Matej, Lana, Timy, and Vito. The all too familiar coronavirus is a disease that hit us hard in the last 2 years and changed our daily lives. We can say that COVID-19 has become quite a global problem present in all age groups. Initially, the theory was that virus infection could only affect those with associated diseases, but experts quickly found that this was not the case and that the virus could strike even those without any previous illness. The pandemic has caused drastic changes, affect many companies, and forced them to adjust their operations in order to remain competitive in the market. Many employees have found themselves in extremely stressful situations due to social, health, and occupational insecurity. Therefore, the Slovenian government very quickly began to take measures to curb the spread of the virus, and above all, to provide one or another assistance in the operation of companies. We have defined and presented these measures in our paper. The main goal of the paper was to present how to reduce the presence of COVID at work. We were also interested in how Slovenian companies prepared for the virus and also took care of the protection of their employees. And we also listed strategies for eliminating or at least reducing the changes of infection in the workplace.
Coronavirus disease, or COVID-19, is an infectious disease caused by the SARS-CoV-2 virus. Severe acute respiratory syndrome, or SARS, is a respiratory disease caused by a virus. The virus can spread through air, through droplets, or indirectly through surface. The first symptoms that usually occur are fever, which is often very high and is accompanied by fatigue and chills, headache, nausea, and muscle aches. In 10 to 20% of those infected with the virus, the disease requires mechanical ventilation. COVID-19, as we know it, was introduced to the world in March 2020. On March 11th, the World Health Organization declared a pandemic, and the day after that, Slovenia also declared an epidemic in the country. Containment measures have begun to be introduced around the world. In June of the same year, the World Bank estimated that a pandemic would bring the world economy into the worst recession since World War II. At the end of 2020, we received the first doses of vaccine in Slovenia. In January 2021, the number of infected worldwide exceeded 100 million. The version of Delta virus that was discovered in India became the dominant version in the summer of 2021, triggering a third wave of infection. At the end of 2021, the World Health Organization drew attention to a new version of virus Omicron that caused concerns due to its contagious and many mutations.
Here are some measures to reduce COVID-19 at work. Make sure that your workplaces are clean and hygienic. Promote good respiratory hygiene at the workplace. Encourage regular hand washing of employees, contractors, and customers. Get advice to all employees and contractors to consult national travel advice before going on a business trip. Anyone who has a mild cough or a low temperature should stay at home as soon as possible and tell their boss about this. Meeting and event organizers needs to consider the potential risk of COVID-19, as there is a risk that people attending their meeting or event will bring the COVID-19 virus to the meeting. Others might be unknowingly exposed to COVID-19. Although COVID-19 is a mild disease for most people, some can be severely affected. About 1 in 5 people with COVID-19 needs a hospital treatment.
Work from home. As the COVID-19 pandemic has spread around the world and social distancing has been needed to reduce it, governments may encourage or even demand reduced physical presence in the workplace. The answer is that a large number of companies are turning to digital technology to continue to operate. So staff have worked from home and used tools such as video conferencing, some cloud services, and virtual private networks. Companies that could take advantages of existing teleworking capabilities or adapt quickly so that they were the best equipped to make a relatively smooth transition from work to home and thus best maintain the level of production.
Due to the COVID-19 epidemic, employers are under great pressure to ensure that appropriate precautions are taken to protect their workers as well as their customers, thus preventing the spread of the disease and further infection. I'm going to name six possible solutions to reduce diseases at work in different industries. So the first is the identification of workplaces where there is a great risk of infection, and those are health jobs where contact with potentially infected patients occurs, places where employees are in constant contact with customers, and others. So the second, a plan with solutions that will reduce contacts between employees and workplaces where there is a great risk of infection. The best solution is that the most employees who can work from home. The third is reorganization of jobs in production in order to reduce the number of employees in the same space. Fourth is the workplace hygiene, so regular cleaning and disinfecting the surfaces is required, like my colleague explained before. Fifth is self-protection and responsibility towards others. And the sixth is reassignment and waiting for work. This includes workers in vulnerable groups. So those are workers with transplanted organs, workers with cancers, workers over 65 years old, pregnant women, and so on. That's all from us. I would like to thank you for your attention and wish you a good day.